I'm Dr. Nicole Murphy, and I've been working with families to improve their health and well-being since 2005. My expertise in pediatric and pregnancy care is an integral part of our practice. I'm also trained in acupuncture, and my goal is providing wellness for the whole family. The following is our Seeds of Wellness series. Each video will address a part of your health: physical stress, chemical stress, or emotional stress. Today, we are delighted to have Dr. Laura Rues from Kansas City Integrated Health. Welcome, Dr. Rues. Maybe you could start today by explaining what naturopathic medicine is.
Sure. Naturopathic medicine, it is a system of healing, really looking at the holistic perspective of what's going on in the body, not only a specific symptom, to try to get at the root cause of a condition. So we're combining traditional therapies from acupuncture to nutrition and diet and lifestyle change, and even sometimes medication management when necessary. Infertility is defined as an inability to conceive after a year of trying without contraception under the age of 35, and then after the age of 35 it's defined by 6 months. Also, if a woman has had 2 or more miscarriages, that's considered infertility or recurrent pregnancy loss and needs to be addressed. It's quite unfortunate that there are about 1 in 6 couples that struggle with infertility or subfertility. So it's quite common, and if you're having issues, then definitely seek care from a gynecologist or someone like me.
How does naturopathic medicine help with infertility care?
As a naturopathic doctor, as I mentioned before, we are trying to look at what is the underlying cause to a condition. So for a woman who is struggling with infertility, the question I always like to ask is why? From issues with ovulation or PCOS or another condition, that's usually the factors that trigger or influence fertility. Women can struggle with endometriosis or polycystic ovarian syndrome, thyroid diseases, autoimmune conditions, and more. So what I like to do is try and figure out really the nuts and bolts of what's going on. If you look at a woman's kind of reproductive potential, you can divide it into 4 different stages in the process. The first one is ovulation. Is a woman ovulating? It's pretty clear and simple. You can do a lab test to figure that out. And if that's the issue, then we focus on how do we get someone ovulating. Second is fertilization. That's looking at what's going on in the physical anatomy of a woman, but also what's going on with her partner. So subfertility or infertility on the spouse can be an issue as well. And then implantation, that's another factor that we're trying to look at. How is the endometrium or endometrial uterine lining receptive to the newly formed embryo? And that also looks at how healthy is the embryo? Is it able to survive and then implant? And then lastly, well, not technically infertility, it's looking at can you carry to full term or at least a healthy pregnancy? Because our goal, of course, is not to get pregnant, it's to have a healthy baby and healthy mother.
Now, do you have people who aren't at the point where they want to have babies, but they're still dealing with some of those symptoms?
Absolutely. Our goal with health and naturopathic medicine is getting a woman as fertile as possible. Whether or not she's trying to conceive and she's using contraceptive means, fertility is really a sign of health, because if you're able to conceive easily and naturally, then there shouldn't necessarily be an underlying issue. So if we're fixing a woman's cycle, that's really beneficial. One of the things I find really fascinating and unfortunate is how many women don't understand or know what is a normal cycle. A lot of times I'm spending time with women to counsel them on, no, it's not normal to have 7-day periods. It's not normal to have quarter-sized clots or changing tampons or pads every hour to 2 hours, or unbearable pain, acne, migraines, all before your periods. So it's really unfortunate how people just don't like to talk about these things. Can you blame them? Right. But really counseling them at that first visit on that's not normal, this is probably influencing something, you probably have a hormonal imbalance, let's work with what we know is going on, because obviously there's signs that there's an imbalance going on, and then once we fix those, your fertility actually increases.
Do you work with people who are already doing conventional fertility treatments?
Sure. I would say about A third of my practice, maybe a little less, is women looking at improving their artificial reproductive technology, that's IUI, in vitro fertilization. What we're looking at is improving their chances of conception with their reproductive endocrinologist. I work with women going through IVF frequently to try to increase the number of follicles collected through the stem cycle so that they have plenty of healthy eggs that can then be fertilized and develop, as well as the health of health of those follicles. If we can get their fertility and like FSH and AMH, which are markers of ovarian health, if we can get those optimal, then we can actually help a blastocyst or embryo mature and then able to implant. And also that leads into helping with implantation. So as I said, there's those 4 steps, but the IUI or IVF usually take out the first 2. So then really we're looking at how can we improve implantation as well as carrying all the way through for a healthy pregnancy.
Increasing chances of it being a success.
Absolutely,
Awesome.
absolutely.
What are some of the tools you use to address infertility?
That's a really loaded question. As I said, there's so many different issues. If you're looking at, where is there an issue in that process, we're looking at addressing that underlying issue. So if there's an anovulatory or a lack of ovulation, then we're looking at how do we normalize the hormones and encourage ovulation to occur. If it's an issue with endometriosis or heavy periods, then there's probably more of an issue with implantation. So how do we get the hormones balanced and decrease inflammation in the uterus, or really how do we support ART, so IVF and IUI, if that's what our goals are. And I do that typically through naturopathic modalities. So for the most part, that's a lot of dietary changes and nutrition, potentially some nutritional supplementation, acupuncture, homeopathy, and botanical medicine. I love herbs for the manipulation of hormones. I find they work extremely well if we know what we're trying to target. But it all starts with figuring out what's that underlying cause. So a lot of times we're looking at doing more extensive labs than the OB-GYN or even a reproductive endocrinologist sometimes does.
Do you find that some of the OB-GYNs or the reproductive endocrinologists that are in this area are receptive to what you do?
Yes and no. So in terms of where they're at in the cycle really depends on how open they are. There are a couple reproductive endocrinologists that I work with more closely than others. It depends on what the goals are with care. So if we're working with, diminished ovarian reserve, or that's when there's not enough follicles to respond and we're trying to increase follicles collected with IVF, then a lot of times that's a little bit more open than some of the other reasons for the IVF. But for someone going through IVF, you understand it's a long process, and a lot of times there is a long prep process. And that's when I really do as much in terms of therapies as I can. How can we get ovarian quality healthy? How can we increase or decrease inflammation? Because you want both in the endometrium for implantation. How do we balance hormones and as much as possible before we go into a stem cycle? And that's when really the hormones start to go really high and crazy. That's when women have the most side effects. So I do work with them frequently. I collaborate with them. I write letters to make sure that they understand why I'm doing things and what I'm doing, and I understand what we're doing that will interact and what won't interact, so we're practicing safely.
That you're working together.
Absolutely.
Awesome.
Mm-hmm. And some of them are a lot more open than others, but for the most part, there's not a ton of pushback.
What are your thoughts on acupuncture and fertility?
There are some really great studies, and I have some great clinical experience with acupuncture in preparation for IUI and IVF and fertility patients. I've had some patients that are working with me preparing for IUI or IVF, and we're doing acupuncture, and they actually end up getting pregnant without the medications. That's my favorite. Yeah. But in terms of implantation has some really great results in helping the transfer of the embryo into the uterus so that you can get that positive pregnancy test, as well as for stress relief for the potential mother, because as you can imagine, IUI or IVF is an extremely stressful process. So it helps with sleep and digestion and relaxation along the way.
What is one thing that you would tell someone that is starting family planning?
Oh goodness, one thing. I don't think there's just one thing, but some few things that I will give as little pieces of advice. One, start on a really fantastic multivitamin. You want to make sure that there is enough folate in the system in order to prevent for any sort of neural tube defects. And by the time you get a positive pregnancy test, it's actually too late to start that process because the neural tube's already formed. Another thing is to start tracking your cycles. There are some fantastic apps out there that I really like, and there's tons of free ones, and just starting the process and getting to know your body. And some other small tidbits are trying to be cognizant of how many fruits and vegetables you're eating, as well as trying to avoid any extra exposure to things that would potentially harm pregnancy, fertility, or the baby, such as pesticides. Try and keep those low, or even plastics and anything from the environment that's not exactly healthy for a woman's reproductive system as well as the baby.
Awesome.
Yeah.
That's great. Well, thank you very much for your time.
Sure. Thank you. Thanks for having me.